Hello, in this video we will discuss about the nerve injury and its classification. Neuron is basic structural and functional unit of the nervous system. In mature human, whenever it is destroyed, it is not replaced. It may be injured due to the various reasons such as cutting, crushing, pull, or injury. This injury may damage a nerve variously, and the injury is classified according to the extent of damage. According to the Sedon classification, nerve injury is divided into three grades. Grade 1, that is neuropraxia, grade 2, that is axonotmesis, and grade 3, that is neurotmesis.
Neuropraxia is a first degree injury according to the Sedon classification of a nerve injury. In it, there is a segmental demyelination. Segmental demyelination means that there is a patchy breakdown of the myelin sheet. The point where there is a patchy breakdown of myelin sheath, where there is the demyelination, at that point the action potential is slowed or blocked. In neuropraxia, the damage is not severe enough to cause the degeneration of fiber.
Muscular atrophy is not observed in neuropraxia. There is no degeneration of muscular fiber, no decline of the muscular fiber muscle mass, but only the temporary sensory symptoms are visible like pain, numbness, tingling. The causes of neuropraxia are pressure, mild ischemia that result from the nerve compression, or traction for the short period. In the neuropraxia, the paralysis is incomplete, whereas the recovery is complete and rapid. Second degree of the nerve injury according to the Sedon classification is axonotmesis. In axonotmesis, there is a degeneration of axon take place, but the nerve sheets or connective tissues that are surrounding the nerve fiber remain intact. In axonotmesis, the Wallerian degeneration occurs peripherally. We will discuss about the Wallerian degeneration in another video. In axonotmesis, muscular fiber atrophy is observed along with the sensory loss.
Causes of axonotmesis are crush injury, traction, prolonged compression or stress that cause infraction or necrosis. Infarction or necrosis are basically death of the body tissue, result from the inadequate blood supply. Example of axonotmesis is radial nerve palsy that is associated with the fracture of the shaft of humerus. As we have already discussed in radial nerve video, that the radial nerve goes along with the humerus and it wraps around the humeral head. So whenever there is a fracture of the humerus, there is the injury of the radial nerve.
Now coming toward the third degree injury according to the Sedon classification of nerve injury, that is neurotmesis. It is the most serious form of nerve injury. In it, there is a complete severance of a nerve fiber along with the disruption of the connective tissue covering. The Wallerian degeneration is observed in neurotmesis. The degeneration occurs below the site of lesion. In it, the muscular atrophy is observed along with the sensory loss. Causes of neurotmesis are basically gunshot, stab wounds, avulsion, rupture, contusions, and stretch. No recovery occur in neurotmesis without surgery. Example of the neurotmesis is basically the swelling of the ulnar nerve by the cord on the front of the wrist.
Now coming toward another type of classification, that is Sunderland Classification. He expands the Sedon classification to the 5 degrees. The first degree of Sunderland Classification, or the class 1, that is same as the Sedon neuropraxia or the Sedon first degree. The second degree of the Sunderland Classification is the same as the Sedon's axonotmesis, or a second degree. According to the third degree of the Sunderland classification, there is the nerve fiber interruption along with the lesion of the endoneurium, but in it the epineurium and perineurium they remain intact. Basically, endoneurium, epineurium, perineurium, they are the connective tissue sheets that are surrounding the nerve fiber. In the third degree, the recovery is possible, but the surgical intervention may be required for the recovery. Now coming toward the 4th degree, in the 4th degree classification, only epineurium remain intact. The surgical repair is required for the 4th degree. And in 5th degree, there is a region of the complete transection of the nerve. So, the recovery is not possible without appropriate surgical treatment.
This is simplified table for the Sunderland classification. According to the Sunderland classification, the nerve injury is divided into 5 grades. In grade 1, axon, perineurium, epineurium, they all remain intact and it is same as the neuropraxia in the Sedon classification. In grade 2, endoneurium, perineurium and epineurium, the connective tissue sheath, the connective tissue covering, they remain intact, whereas there is a lesion of axon and myelin sheath. In grade 3, only perineurium and epineurium remain intact, where there is a lesion of the endoneurium, axon and myelin sheath. And in grade 4, only epineurium remain intact. And in grade 5, there is a lesion of the complete transection of a nerve fiber.
At the last but not least, important questions for FUIC students are mentioned in description box. Thank you. Please subscribe my channel, like my video and also share it. Thank you.